I was recently asked by one of my followers to do a video that explains a little bit about hip dysplasia. So I thought I'd give it a whirl and share with you pretty much everything I know about hip dysplasia, which is a pretty good amount. I'm certainly not a veterinarian, but I've had a lot of experience with Cavaliers especially. So let's start with the basics. The hip joint in a dog is where the femur or thigh bone, may I, Apple? Joins to the pelvis, which is here. It's a ball and socket type joint. The head of the femur is, no, I've got nothing in there. I'm just making believe it's a femur. The head of the femur is shaped like a ball, and in the pelvis there is a socket. And the two of them fit together, hopefully, very nicely, and that allows for free movement in every direction so that dogs can support themselves and move themselves effectively from the rear end. Hip dysplasia is a condition where that ball does not fit nicely into the socket, can be just slightly out of position or way out of position. Some of the oh, thank you, very nice to have Bootsy up here too. Some of the possible causes of hip dysplasia involve genetics. I know in Cavaliers it's a very strongly inherited disease. So if the parents of a puppy are both free of hip dysplasia, the chances are really excellent that the puppy will not suffer from hip dysplasia. Also, diet can play a factor. There are some studies even that show, especially in larger dogs, that dogs that overeat and are basically free-fed so that they can eat as much as they want are more prone to hip dysplasia than others that have a controlled diet. And there are a few studies that show that if a dog is spayed or neutered too early in life, the lack of growth hormones can also cause this to occur. When puppies are born, their bones are very, very small and they're not actually connected, so that joint really hasn't fully formed at the hip socket. In order for the hips to develop properly, the femur and the pelvis with the socket have to grow at the same rate. If they grow at unequal rates, then that can throw the connection between the two out of joint, and then they suffer from hip dysplasia. This is a disease that affects large dogs more than small dogs. As I said, it is something that is common to the Cavalier King Charles Spaniel breed, so we are very careful. Any good breeder is going to test their Cavaliers before they breed them to make sure that they are free of hip dysplasia so that they don't produce puppies that have hip dysplasia. If you have a dog with hip dysplasia, it's not really the end of the world as long as it's not a very severe form. Many times hip dysplasia, and especially in its mildest forms, can be treated with anti-inflammatories. And the dogs who suffer from mild hip dysplasia would probably also be on supplements that are geared to joint health. The diagnosis for hip dysplasia is done by X-ray. Let me show you an X-ray here. This is an X-ray of the pelvic area of a dog that is definitely affected by hip dysplasia. You can see the balls at the ends of the femurs, and you can see the sockets that they fit into. But you'll also see a significant amount of space between the ball and socket. In fact, they appear to be slipping completely out of position. This is exactly what we find when there's a dog affected by hip dysplasia. Now, we want to know if any of our breeding dogs have hip dysplasia because we want them to be free of that before we breed them. So Apple here, for example, just turned 2 years old not long ago, and that's old enough for her to be tested. The reason why we wait until they're 2 years old is because that's about the time when all of the growth plates have closed, and that joint should be in the same position that it's going to be for the rest of her life. So let me show you Apple's hip X-ray. This is what the X-ray looks like that we submit to the Orthopedic Foundation for Animals, or OFA, who does the evaluation. But if you look closely at the pelvic area, you can see between the ball joint at the top of the femur and the socket in the pelvis, there's an extremely tight fit with very little space. So you can see the difference between a dog with hip dysplasia as opposed to a dog whose hips are in good conformation. Now, I mentioned the Orthopedic Foundation for Animals, OFA for short. They have a website, very informative, a good place for you to go. And the procedure for evaluating a dog's hips is for us to have an X-ray taken. The X-ray is sent directly from the vet who is doing the X-ray to the OFA. The dog is identified by its microchip number, so that there's no possibility of anybody pulling a fast one on the OFA and substituting a healthy dog for one that's not so healthy. And the OFA has several orthopedic specialists take a look at those X-rays and evaluate the hips. Now, it is a bit subjective, and that's why there's several specialists who are involved in the evaluation. There are 7 different levels that the hips could be rated. 3 are acceptable and 3 are unacceptable as far as breeding is concerned. The 3 levels of hip conformation that are considered acceptable are excellent, good, and fair. And don't think that fair is kind of like, nah, not so great. All of those are considered passing grades for hip conformation. Here's a copy of the certificate we got for Apple from the OFA showing her hip conformation. If you take a look down on the lower right, you'll see that it says good, which means that she is in the next to highest rating level for hip conformation. So we're very pleased with that, and we have no hesitation to breed her as far as the hips are concerned. There are also 3 levels of hip dysplasia for dogs that are affected, and they are called mild, moderate, and severe. I think that's pretty self-explanatory. And the 7th level is in between. It's called borderline. But borderline simply means that there wasn't quite enough information for the orthopedists to agree on the diagnosis. One more thing of interest, there is another way of evaluating hips. It's not recognized by the American Kennel Club the way the OFA rating system is, but it is something that a lot of breeders do use anyway. It's less subjective, it's more precise. It's called pen hips, and when you get a pen hip evaluation, well, first of all, you have to make sure your dog doesn't try to upstage you with the camera. And secondly, when you get a pen hip evaluation, you will see what they call a DI index, which is a number from 0 to 1, where 0 would represent hips that are perfect conformation, and 1 means that it's a severe case of hip dysplasia. And you'll also get a percentile rating, which will tell you where your dog stands. So, for example, if the dog gets a 75%, that means their hips are better than 75% of dogs in the same breed who have been evaluated. So I hope that's been slightly enlightening for you. My biggest recommendation is, oh, well, thank you. I'll shake hands with you anytime. My biggest recommendation to you is, funny, that if you're looking for a puppy, you should ask to see the certificates that show that both parents of the puppy have been cleared for hip dysplasia. And now you know what the OFA certificate looks like. And by the way, one more thing, if you know the official registered name of the dog you're concerned about, you can go onto the OFA website and you can do a search by the dog's name or their AKC registration number if you happen to have that, and you'll get all the health test results that have been registered with the OFA for that dog. So that's a way you can find out for yourself. So I hope that's been helpful to you. If you have any questions, feel free to leave a comment and I'll be happy to answer you. Meanwhile, Apple, shake hands on this. Bye.